I'm joined now by the Health Secretary, Matt Hancock. Mr. Hancock, good morning to you.
Good morning.
As Health Secretary, you must be feeling very happy and mightily relieved to see this come to fruition this morning.
I'm feeling quite emotional, actually, watching those pictures. It's been such a tough year for so many people, and finally we have our way through it, our light at the end of the tunnel, as so many people are saying. And just watching Margaret there, it seems so simple having a jab in your arm, but that will protect Margaret and it'll protect the people around her. And if we manage to do that in what is going to be one of the biggest programs in NHS history, if we manage to do that for everybody who's vulnerable to this disease, then we can move on and we can return to normal. And I'm just so grateful to all of the team who've made this happen. You were talking about MHRA, the regulator. Not often regulators get a big round of applause, but I think the country should be applauding them. And to, of course, the Vaccines Task Force and Kate Bingham, who spotted this vaccine and bought it early, and then to the NHS family who are going to make this happen. There's enormous amount of work still to do. I think it's very important that we stress that, but I'm really, really grateful to everybody who's brought us to this moment.
And what does this moment this morning represent? It's been described as the beginning of the end, but where do you see that end coming? Does this represent your through this by spring thinking?
Well, the first thing it represents is the triumph of science and human ingenuity over what is a absolutely beastly disease. That is, I've always believed that through backing the science we would get there. And today is a big moment in scientific endeavour. And this can start to heal this disease right across the world and protect people everywhere through these vaccines, this being just the first one. In terms of what it means here in the UK, of course, it's great news that we are the first country in the world to have this clinically authorised and being able to roll out this programme. And when enough people who are vulnerable to COVID-19 have been vaccinated, then, of course, we can lift the restrictions. It is very important to say to everybody...
When is that? When do you anticipate that will be, Health Secretary?
Well, we think that will be in the spring. It's very important for everybody watching that whilst we vaccinate people, and we will do that at the pace at which the manufacturers can produce the vaccine, whilst we vaccinate people and whilst we get that second dose in, we've got to hold our nerve, we've got to stick together, and we've got to follow the rules. It's no good everybody relaxing now. We've got to hold firm until the vaccination programme has reached enough vulnerable people so that we don't have people dying from coronavirus in the numbers that we do today, which is still much, much too high.
OK, you mentioned there the pace of manufacturing. How many of the 800,000 doses from Pfizer are here now? And when do you expect the next consignment to be coming in? We were expecting a lot more, weren't we? We have been told up to 4 million by the end of the year. Is that accurate?
Well, the 800,000 are in the country, and many are in hospitals across the UK. We've got up to 80 hospitals will be delivering the vaccine today, and up to 70 hospitals delivering the vaccine today. Of course, in one example, the vaccine is no longer in the hospital; it's in Margaret's arm, which is wonderful. And then, in terms of the future, we have several million that are agreed with Pfizer to be delivered in the remainder of this month. We're not putting an exact figure on it because that manufacturing process is itself difficult, and we've got to make sure that they're brought into the country safely. But as they're brought into the country and ready to be deployed, then the NHS will be there and ready to make sure that people can get them, to help to make sure that we protect people from the disease.
Yeah, I want to ask how confident you are in that supply chain. You've talked about potential difficulties in manufacturing because 800,000 doses is 400,000 patients because the second dose is being held back for them. Does that suggest that you're not expecting enough to come in within the next 3 weeks?
Well, we've always expected the vast bulk of the vaccination programme to be in the new year. So for people watching, if you're in your 80s, then the NHS will get in contact with you and invite you in to be vaccinated. But the vast majority of people will be vaccinated in the new year, not this side of Christmas. So that's
the reason I'm asking, I suppose, is you could have taken the decision to vaccinate a full 800,000 patients on the basis that you were expecting to get the next doses in within that time frame. Are you saying that you're not expecting those?
No, I'm not saying that, actually. We have a high degree of confidence in the delivery that will come next week, which means that we are able to get going on the full number. But the rollout will start, and it will start in those up to 70 hospitals that I mentioned across the UK, and then it will roll out and get broader. You were discussing in the bulletins I was listening to the need to get to care homes, because obviously many care home residents are both very vulnerable but also can't travel easily. So we need to make sure that we get to care homes, and we want to use GPs and pharmacists to be able to get the vaccination sites closer to where people live. So we start with the big hospitals, which is what we're doing today, make sure we get all of the processes smooth and straight and get this off to a good start, and then we'll expand the number of the number of centres that we have to be able to reach people.
OK, and in terms of care homes, because care home residents are in that top priority bracket, where are we in terms of getting approval from the MHRA to get batches into care homes so that the vulnerable can be vaccinated in situ?
Yeah, so it's incredibly important that not only do we have the vaccine itself approved, but also that the delivery of the vaccine is safe. Because it has to be kept at -70, famously, we've got to make sure that the process of getting the vaccine to the site is itself safe. And that's what the MHRA have been working with the NHS to make sure we have the protocols in place for that. The reason that that's taken a little bit longer is that the full characteristics of this vaccine were only known a couple of weeks ago, so they've worked at incredible pace to get this into place already. And we'll get that sorted in the next couple of weeks. So we hope to be vaccinating in care homes.
So before the end of the year?
I hope to be vaccinating in care homes before Christmas and start that programme before Christmas. But we will only do this as fast as it is safe to go. That's been our principle all the way through. And, as you've seen from what we've managed to achieve so far, the regulator working with the NHS can do this swiftly and in a smart and agile way, but they're doing it in a way that is safe. And so that's the reason we've just got to make sure that the processes we have to get the vaccine safely to the care homes is done in a way that means that it is absolutely secure. And I'm sure people will understand why it's worth taking the extra few days to get that process sorted, whilst, of course, we can get started with the programme in hospitals, as Margaret's demonstrating with you in Coventry.
Can we get clarification from you as Health Secretary on the issue of vaccine passports? These are the vaccine cards, appointment cards or reminders that people will be given. After they've had the second dose of the vaccine, do they no longer need to carry those, or do they need to maintain those, keep them on their person at all times?
They don't need to carry those at all. They are standard NHS reminder cards, because you have to have the second dose, obviously. So it's critical that we give people an appointment and that they can come back for that second dose. So These cards are a standard NHS reminder card for your follow-up appointment for the second dose of the vaccine, which is what gives you the immunity, having both of the doses. We're not proposing to have a sort of immunity certificate that allows you to do different things. What we want to do is get as many people vaccinated as quickly as we safely can. And then once we've protected those who are vulnerable from COVID, then we can start to lift the restrictions that we've got in place. And I want to lift those restrictions as much as anybody does, but I only can possibly recommend that when it is safe to do so. And it'll be safe once we've vaccinated enough of the people who are vulnerable to the disease. That's the plan, and it will take some months to get there. But what is absolutely critical is that in the meantime, everybody follows the rules. This is I can't overemphasize this enough, that we are not there yet. We've taken a big step forward, but we're not there yet, and everybody still needs to follow the rules, because I think it would be terrible if we were to see that we've now got the solution. It is coming. It is being delivered. And if we all relax too much at this point, unfortunately, then the virus is still a deadly disease until we've got enough people protected from it. So let's stick at it.
As well as the logistical challenges of rolling out the vaccine, you've also got challenges around disinformation. As Health Secretary, what do you say to those who may be concerned or sceptical about having the vaccine?
Well, I think that the best people to speak on this are the clinicians themselves, and those who spend their lives and are experts in vaccine development. Who will explain very clearly that a vaccine is so much better than getting the disease. It is safe. We would not have allowed this moment that we're seeing on our screens to happen if it weren't safe and approved by the regulator, which is the MHRA, which is globally respected for its judgments. And critically, the clinicians in charge of this, like Professor Jonathan Van Tam, are recommending the vaccine not only for others, but also for members of their own family when it's appropriate. So, listen to the trusted voices, listen to the clinicians, and it's clear that getting the vaccine is good for you. And it's good for your family, and frankly, it's good for the country, because we need to get enough people vaccinated so that we can then be able to lift the restrictions.
Away from the vaccine now and Brexit, the Prime Minister had a very lengthy call yesterday evening with Ursula von der Leyen. No progress made. Did an EU ambush derail the talks?
Well, obviously, I haven't been involved in the day-to-day of these talks. What I can say is that I know the Prime Minister is straining every sinew to try to get a deal that works for both the UK and the EU. That deal is potentially doable, but the EU obviously has to want to do it. And he's therefore prepared to travel to Brussels to really lean in to trying to get that deal. But at the same time, we're fully prepared for whatever outcome. We're ready to proceed without a further agreement if that is what the EU decides. But we've got to make sure that we negotiate hard and we put everything into it, and that's what the Prime Minister is doing.
Health Secretary Matt Hancock, thank you very much for joining us this morning.
Thank you. Good to be on.